So thank you everyone for joining our webinar on pharmacy app alert, notification, and reminder management capabilities. My name is Jose Santana, and I'm a product strategist here at CI. And just a quick reminder, so everyone registered will receive a copy of the recording and the presentation deck after this session. All right, we have a lot to get through, but should be able to cover everything in 30 minutes or so. So hopefully that gives everyone some time back. So let's get started. First, a little bit about corporate insight. So for almost 35 years, CI has been providing actionable competitive intelligence and customer experience analysis to the nation's leading financial services, insurance, and healthcare firms. And here are 4 core offerings, but at a high level, all of our services help our clients track and utilize industry trends, understand changing consumer, member, and patient behaviors, maximize competitive advantages, and improve the prospect user journey. So in our latest analysis in the online pharmacy space, we find that intelligent capabilities for prescription notifications present a strategic opportunity to really digitally transform pharmacy services. Throughout this session, I'll explore how leading pharmacy players are leveraging these sort of intelligent notification capabilities, as well as customizable reminders and advanced adherence tracking to enhance medication access, affordability, and health outcomes. And we will also examine some of the emerging best practices in the space around things like privacy, personalization, and gamification, all which really can support organizations by fostering stronger brand loyalty and ultimately driving that sort of distinctive competitive edge. Here we have some data from one of our recent surveys where we asked over 2,000 pharmacy consumers what device do they use most often to access and log into their pharmacy's customer account. So we see here, and we know that pharmacy consumers across all generations are mobile first. Specifically, when asked about discrete account and plan servicing activities performed on the pharmacy consumer's website and mobile app, not only did we find that all plan servicing activities were performed more frequently on mobile apps than on desktops, but setting alerts, reminders, or notifications show the largest usage gap between website and mobile app respondents. And the belief is that mobile use will only continue to increase. Alert, notification, and reminder capabilities are both vital to the experience of a pharmacy customer and also show a significant opportunity for further development for pharmacy organizations. We also know that pharmacies and patients alike stand to benefit greatly just from simple medication reminder programs. So for the consumer, prescription reminders provide convenience, they provide peace of mind and potential cost savings by reducing unnecessary disease progression or complications from lapses in medication usage. And from a pharmacy revenue standpoint, dosage and refill reminders ensure continuous medication usage and can catch users before they drop off therapy. So we know and we see that pharmacies with prescription reminder programs have seen higher retention rates for chronic medications than pharmacies without such programs. So shown here from a study published in the Journal of Managed Care Pharmacy, we see adherence rates for 2 types of medications over 12 and 24 months. So the blue bars represent the group receiving the intervention, so specifically SMS reminders and discounts, and the purplish bars representing the control group, so the groups that didn't receive anything. And so clearly we see adherence rates are higher for all the patients receiving these interventions. So in terms of the analysis, Corporate Insight evaluated the alert, reminder, and notification experience across the following 21 mobile apps. And this was really to truly understand the user experience and also be able to identify best-in-class functionalities. And we do cover a range of organizations across health plans, across PBMs, retail pharmacies, and online pharmacies. So when it comes to the type of communication topics that users can control, online pharmacies should offer a diverse set of prescription notifications. And so the more useful a notification, the more incentivized consumers are to actively retain the app longer. However, you may not always know how useful one notification may be over another. So really offering a variety of reminder types that are tailored to various regimens and lifestyles that really ultimately improve compliance across all patient types. So in general, over 62% of the pharmacy apps that we reviewed offer notification management functions for topics surrounding custom dose and medication reminders, non-specific order statuses, refill reminders, and general marketing communications. But there really is a missed opportunity here for more apps to offer user control over notifications that are either customizable, like copay alerts, or specific to their orders, like shipment confirmations or shipment delays. And really, this is not to say that customers may not receive a notification around something like an order delay or a copay alert, but we only considered it in our analysis if the pharmacy had such topic in their app in which the user was able to control that communication specifically. Which brings us to our next point. So where we know that too many notifications can be counterproductive and can ultimately result in app abandonment. So organizations can really prevent such overload by allowing users to curate relevant interactions by giving them control over notifications. While we do see some firms such as Express Scripts and Walgreens provide users with notification settings for up to 5 diverse topics, like prescription status, order status, savings opportunities, benefit alerts, and safety alerts, they'll also group all of these topics in a single option, which really, it's a poor job because it eliminates the control that users have over their accounts and communication with. Instead, pharmacy apps should allow users to individually control each communication topic. So this is an area in which Aetna, CVS, Caremark, and Kaiser Permanente apps excel, as they offer users a variety of topics and also enable them to control each topic individually through clear and well-designed controls. So exemplified here by Aetna, CVS, Caremark, and Kaiser Permanente, these apps offer clear and simple toggles to a variety of notification topics. Also notably, Kaiser Permanente and CVS Caremark include brief descriptions of each to further enhance comprehensibility. Notification options for medication cost saving opportunities is also less common across the industry, which only 19% of the apps in our research offer. So these sort of cost-saving notifications provide financial benefit and can incentivize ongoing use of the pharmacy app and services. This can be things like coupons or loyalty programs or generic substitution notices. And this is especially true for customers with high drug costs, as the ability to save money can be highly motivating. Here we have an example of the GoodRx notification screen, which offers simple yet clear and intuitive preferences to enable push and SMS notifications for marketing and cost savings content. And all the way on the right, uniquely, Centerwell is the only firm in the report to offer users with a custom copay alert function that notifies users when their prescription copay surpasses a specific amount that is set by the user. Outside of the notification topics identified across the apps in the report, online pharmacies have an opportunity to provide a wide range of additional options that cater to a diverse set of client needs, as well as the ability to promote better medication access, affordability, and education. We know that firms that can implement some of the following notification preferences as distinct options for users to control can gain a competitive advantage as differentiators. And some of these potential topics can include things like prescription transfer alerts, prescription price drop alerts, coupon alerts, drug recall or shortage alerts, adverse effect education warnings, vitamin or supplement reminders, payment receipts and alerts, and event reminders, which could be reminders about upcoming pharmacy clinics or health fairs. Next, offering robust preference delivery options for notifications demonstrates that consumer needs are the priority, especially as users have different communication preferences. So really allowing them to select their preferred notification channel will enable them to customize interactions in a way that is most convenient and accessible to them. We know omnichannel joins communication touchpoints, so the experience is consistent and unified no matter which channel the consumer chooses or moves between. Also, a true omnichannel experience promotes accessibility, as some users might have difficulty receiving notifications through certain modalities. So if, for example, those with visual impairments can opt for automatic phone calls or text. We see email as the most common notification delivery control method, which is offered by 81% of online pharmacy apps. Slightly fewer firms offer customers control over text message communications they receive from their pharmacy. Also, surprisingly, less than half of the industry apps offer control options for push notifications, which are huge mobile experience engagement drivers. So having that low 48% number is quite surprising. And then only 43% of pharmacy apps in our review offer phone call notification delivery control. And this is either for a phone call with a live person or automatic or automated system. So at a minimum, it is a best practice for digital pharmacy strategies to provide omni-channel notification options for text, for email, for automatic call, and for push. There were only 3 pharmacy apps in our review that stood out by providing delivery method options through all 4 of these channels. And that was from BirdieRx, CenterWell, and Walgreens. So here we see the Walgreens app, which first has this on the left side, the notifications and settings screen, where users can then manage notifications across different delivery methods and each on a separate screen. So on the right side, there's a screen for push notifications, one for text messages, and one for email. Within these preferences screens, firms should strive to offer further control for customers to not only set their preferred delivery methods, but also to update corresponding contact information. So this creates a consolidated and streamlined approach that aligns with core user-centric design principles, which is essential to the digital experience. Only 38% of organizations in this report offer the ability to update contact information from the delivery option screens, with most of those featuring an edit link to change personal information. Here, the BirdieRx app really does excel, as it enables customers to update personal contact information corresponding to the selected communication method on its contact preference screen. Notably, the contact information field instinctively changes when customers select a new communication method. So if their preference is for that topic is, let's say, email, an email address field is displayed, or if their preference is to receive SMS text messages, the screen will present a field for a cell phone number. So never requiring the user to leave the current task or navigate to another screen. Next, we get into more customization features. So here we're talking about customizable medication reminders, which should really make it easy for the average user to create effective reminders tailored to their abilities and preferences. We find that the most effective apps enable users to add a new reminder for a medication that may not be filled by that pharmacy. And this is done mostly through medicine cabinet functionality. Specifically in our analysis, only 24% of firms in this report, including here by GoodRx and WellRx, have this capability for users to add any new prescription to the app. So we know that this may be a challenge for some organizations like health plans and PBMs compared to more direct-to-consumer pharmacies, but from a user perspective, this is very convenient. So while a user may not have all their prescriptions filled at a single pharmacy, app functionality should allow customers to create reminders for both new and existing prescriptions. So those customers can at least manage their reminders from one single source. When it comes to custom prescription dose reminder capabilities, CenterWell and Walgreens are two of the best in class. So both apps offer highly customizable options for reminder/dose frequency, from daily options to specific days during the month. Both apps also offer open entry fields that the user can add any sort of useful information or details to each reminder. CenterWell and Walgreens are also the only two firms to include extended dosage instruction options for each reminder, including taking the dose with or without water, with or without food, or without alcohol. And Walgreens is the only firm in this report to offer a prompt for a second reminder 15 minutes after the first, which is a fast and easy, effortless way for users and online pharmacies to improve adherence. Next, it is extremely effective to feature push notification functionalities for users to log and monitor their prescription adherence, which for the user can provide the motivation to improve compliance through intuitive set prompts. Here exemplified on the left, pharmacy app default push notifications range from generic, it's time to take your meds, like with WellRx, to a more friendly tone, like with Alto Pharmacy. And then others like Accredo and Walgreens that include additional details such as the set time of day, the drug name, and drug strength. Even better are actionable alerts, which remove barriers to logging doses by allowing users to simply click an I took it button or I did not take it button. And because tracking through notification happens in real time at the point of care, this improves data accuracy by reducing a person's reliance on recall or a more manual logging process. We haven't seen this from any pharmacy app push notifications, but on the right, we have an effective sample that not only provides patients with important drug and dosage information, but also provides interactive or actionable prompts to enter, either log their intake, or to snooze the notification for a set duration. Within the app itself, just fewer than half of the firms assessed in the report offer customers the ability to mark a dosage reminder as taken or missed. Apps like CenterWell and CVS Specialty offer well-designed functionalities through an intuitive user experience. So these apps present all reminders on screens by date and time of day and include all corresponding actions like mark is taken or mark is missed or skipped. as well as pause, edit, delete, and set up a new reminder. But equally important as having this self-tracking functionality is presenting track adherence through compelling visualizations. So we know that intuitive charts, graphs, and timelines help customers digest personal analytics and detect patterns. Best-in-class tracking experience provide a visual representation of good or poor adherence, either through green check marks or through progress charts, represented here by CVS Specialty and NewRx. And ultimately, these visualizations help make trends more resonant. They show gaps more clearly, and they prompt self-awareness and course correction without judgment. By far, the most robust experience we found when it came to adherence data and trend visualizations was the CVS Pharmacy app. So the app features bar and pie charts for daily and weekly prescriptions marked as taken, skipped, or not reported. Customers can assess their adherence week over week and over the span of various times throughout the day. And notably, customers can also identify and filter for prescriptions marked as skipped. For pharmacies, access to such adherence data provides insights into user behavior or medication taking patterns. By identifying customers who need more support, pharmacies can inform and improve patient-pharmacist relationship and effective engagement strategies like adherence packaging or custom reminders. Medication tracking also allows pharmacies to highlight adherence rates to manufacturers and health plans as proof of improved outcomes. Lastly, it is key for pharmacies to focus on privacy and provide prescription discretionary functions to support benefits and accessibility, as well as adherence and to build trust. The most common function we see is the ability to hide drug names from alerts, which 45% of firms do so. This helps ensure that users don't only miss a dose due to social concerns, but it is especially useful for medications pertaining to sensitive health conditions or those that may carry stigma. Settings that we rarely see on pharmacy apps are for unique notification sounds or vibrations or symbols that may only be recognizable to the customer. So Walgreens is the only firm in this report to set a pill reminder sound effect, letting users choose between 4 preset sounds. However, the app does not provide sound previews, which would help customers determine their best option. Other potential discretionary features that are not prevalent at all include those that allow customers to schedule blackout times when they don't want to receive a notification, like during work hours, or snooze options that can provide control over time. We see such features on some internal operating system apps, but users may not want to enable these settings across their entire mobile experience. Really, customers benefit the most from having these blackout and snooze settings available for certain medications and reminders within the pharmacy app itself. So to bring it all together, we find that the most effective apps offer customizable reminders tailored to diverse user needs, which we know helps improve medication access, affordability, education, and health outcomes. We also see advanced apps provide flexible prescription reminders and tracking rather than a one-size-fits-all experience. Notably, delivery methods should always accommodate different communication preferences. So through omni-channel options, like through email, phone, text, and push notifications. Further, we see that integrating tracking functions into actionable alerts removes barriers to logging doses and caters to that mobile-first, mobile-first users. Ultimately, the most effective and intuitive apps for building reminders, they remove friction while still offering robust options through smart push notification defaults, presets, and guided flows. Also, discretionary functions are top of mind for consumers, especially regarding certain medications. Currently, few firms provide control over notification patterns or sounds to protect privacy. And balancing discretionary controls with the right defaults and prompts is important. So while firms should always encourage notifications for improving adherence, they should also employ more private settings for users that need, that more privacy. The inclusion of gamification elements presents an exciting and severely underutilized opportunity in the space, as none of the firms in our analysis feature a gamified approach to medication dosage reminders and tracking. Specifically, elements like awarding points or badges for taking medications consistently could significantly boost adherence and user engagement. So this strategy not only benefits users by promoting positive health behaviors, but it also creates a stickier app. And ultimately, a frictionless, user-first mobile experience will foster that sort of trust, and it does demonstrate a pharmacy's commitment to its